a world striving for progress, why does the development gap still persist? In developed communities, people have access to better opportunities and services. Families have stable jobs, enough food on the table, and reliable transportation such as cars. Clean water is easily available, and hospitals are modern, where patients receive proper medical care. Schools are built with strong concrete buildings, and students learn using books, televisions, computers, and other modern tools. In many less developed communities, life is very different. Some families live in small houses made of woods and light materials. Some children are forced to work at a young age to help their families survive. Clothes are often worn out, and some do not have proper things to wear. Hospitals are overcrowded and lack enough resources to treat everyone properly. Schools are not always built with strong concrete buildings, and many students have limited access to books, computers, and the internet.
On the same planet, millions of people wake up with dreams for a better future. However, not everyone has the same opportunities. Some live with advanced technology and modern hospital and quality educations. Others struggle with poverty and lack of basic needs. This global inequality is known as the development gap.
Development gap refers to the wide difference between rich and poor countries in terms of wealth, education, healthcare, and living conditions. It shows how development is uneven, creating two very different realities in one world.
To understand this issue, we must look at its root causes. First, colonialism. Many countries were controlled in their past. Their resources were taken and their economies were weakened.
Third, debt and financial dependency. Many developing countries borrow money and spend large amounts paying interest instead improving education and healthcare. Lastly, corruption and poor governance slow progress and reduce trust in leadership.
The effects of the development gap are not just economic, they are deeply human. Children drop out of school, hospitals lack equipment, families face unemployment. This creates a cycle of poverty that can last for generations.
Although the problem is complex, solutions are possible. Governments must promote fair trade and transparency.
Did you know that prioritizing patient safety and comfort is paramount in non-emergency medical transportation? For instance, a study conducted by healthcare organization 𝐼 emphasized the importance of providing safe and comfortable transportation for patients with chronic conditions. By implementing proper vehicle maintenance, trained drivers, and adherence to safety protocols, non-emergency medical transportation providers can ensure a positive experience for patients. This approach not only promotes patient well-being, but also enhances the reputation and trustworthiness of the non-emergency medical transportation service provider.
Education and healthcare should be prioritized. Students and global citizens can raise awareness and support equality.
The development gap is real.